Welcome everyone to today's webinar, Mobilizing Action for Climate, Health, and Equity. Thank you to our webinar co-hosts, all of whom you can see listed here, and to our speakers for joining us today and for their leadership on climate and health. Today we will learn more about the U.S. call to action on climate, health, and equity and policy action agenda, including the 10 priority actions to protect and promote health and advance the well-being of all people in the era of climate change. We will hear from health voices from around the country working at the forefront of climate solutions and what you can do to move the policy action agenda forward. Next slide, please. We are grateful to all of you for being with us today on this webinar as part of our celebration of National Public Health Week. As we practice physical distancing, we are still trying to engage in some distance socializing to talk about climate and health action, a topic that demands our focus even in these trying times. We want to take a moment before we begin to hold in our hearts those frontline workers in healthcare settings, grocery stores, shelters, sanitation, and countless other professions who are still working outside of their homes, putting themselves at risk of contracting COVID-19 to protect countless others. They make it possible for the rest of us to heed public health warnings to stay at home. Thank you for all you are doing. Next slide, please. A few housekeeping items before we begin. We know most of you are calling in from home, as are we, and are on our personal internet bandwidth. Please be patient if we experience any technical glitches. All attendees are in listen-only mode. You can use the chat function on your screen to communicate with us, ask questions for the panelists, and add useful links. During the webinar and in the days and weeks following, we invite you to engage with us in this conversation and in the actions we will review on social media and other online forums. Next slide. Our goals for today are that this webinar and accompanying tools and resources will help build awareness about the policy action agenda, inspire collective advocacy actions, and catalyze further outreach. Next slide. Today, we are going to hear from several leaders. Most speakers will just be able to give a snapshot of what they're doing. We have started a blog series from our speakers on climateforhealth.org to expand on their stories. Please check them out to learn more. Next slide. My name is Rebecca Rear, and I am the director of the Climate for Health program at EcoAmerica. I will be serving as your moderator today. Climate for Health is a national initiative to build climate leadership and action in health, advancing solutions that protect personal and community health. Climate for Health is a program of EcoAmerica, which builds institutional leadership, public support, and political will for climate solutions in the United States. We offer tools, resources, and communications to demonstrate visible climate leadership, inspiring and empowering health leaders to speak about, act on, and advocate for climate solutions. Next slide, please. We work to empower health professional leadership on climate action because healthcare professionals are, as a group, some of the most highly trusted professionals. As you can see in the results from this Gallup poll on honesty and ethics in professions, nurses and medical doctors are at the top. As for most things, climate included, the messenger matters. On top of being highly trusted, health professionals are already seeing the impacts of climate change on their communities and their patients, and are therefore well positioned to talk to their peers, the public, and policymakers. Next slide. And people are ready to receive this message. We found in our polling that 2/3 of Americans believe that if the US took steps to prevent climate change, it would improve our health. But the thing is, when you ask whether people are hearing from health professionals about climate change, they're not. Climate for Health has a new resource, the Moving Forward Guide, that is for health professionals in small offices, clinics, and health departments who want to lead on climate and need support to act. The guide helps health professionals engage their profession and their community and policymakers using clear, positive, inclusive, and relevant messages. Next slide, please. We also have found that although almost 3/4 of respondents say they are personally concerned about climate change, only 59% say that others around them are concerned. This 15-point gap between reality and perception may explain some of the inaction on climate and is something we are here to help address. It is now my pleasure to turn it over to our first speaker, Linda Rudolph.
Good morning. Can you hear me?
Yes, we can hear you.
Okay, great. I want to thank very much the great team that put together this webinar, and especially Rebecca Rare, who kept us all on track. Next, and I want to echo Rebecca's thanks. Next slide. I want to echo Rebecca's thanks to the millions of healthcare and public health professionals and so many others who play unsung and crucial roles in responding to the COVID pandemic. With our world having turned upside down in just a few weeks, I also want to thank the literally hundreds of you that are on this call this morning to talk about climate, health, and equity for sitting in on yet one more virtual call. Next. This curve is why we're here. Next. There's been 5 recent high-level scientific reports that have documented what our failure to curb climate pollution means. Next. Even if we meet the Paris Agreement commitments, we'd see a 3.2 degrees centigrade temperature rise in this century versus the 1.5 degree warming that the world scientists say give us some hope of reverting catastrophic climate change. And to change that course, emissions need to drop rapidly. And yet we're on track for higher and higher levels of CO2. So climate action is urgent. Next. There's been a series of other high-level reports that look at the health implications of climate change. And what those reports tell us next is that climate change is impacting our health now, that the warmer it gets, the worse it will get, that climate actions have massive health benefits, that we need to adapt and mitigate for climate change, and that failure to take transformative action with great urgency risks catastrophic effects on human health and well-being, and possibly on the survival of human civilization. In other words, climate change is a global health emergency. Next. Climate change occurs against a backdrop of very significant health inequities that are largely due to historical disinvestment and marginalization, and that have led to stark differences in the social, environmental, physical, and services environments of people in different neighborhoods, different classes, and of different race and ethnicity. And those stark inequities contribute next to a climate gap. Climate disproportionately impacts and harms people of color and those in low-income communities. Next. We know that the causes of chronic disease and health inequities are largely the same as the causes of climate change. We know that transforming our energy and transportation systems, our land use patterns, our buildings and housing, our food and agriculture system, and our use and abuse of natural resources would provide a huge and wide array of health benefits. And that's why the Lancet Commission said that tackling climate change could be the greatest health opportunity of the 21st century. Next. But we also know that large-scale transformative change in systems and policies is not easy at any level of government. And if we as health professionals want to be a voice for change, we need to get under the hood and start to understand what our policy priorities are. What are the changes that we think can bring about the greatest combination of health and climate benefits so that we can partner with people in every community and with others to advocate for those changes. And our hope is that the US Call to Action on Climate, Health, and Equity, a policy action agenda, will help health professionals around the country do just that. With input from dozens of health experts and people who understand these other sectors that we must change for health and climate, we tried to first articulate why health professionals must engage in the fight for climate solutions, and then really look at which climate solutions are also priority health solutions. Next. So the policy action agenda identifies 10 priority actions in 2 broad categories. The first is climate action for health. From a health perspective, what are the most important climate solutions? First, we need to get back into the Paris Agreement and double down on our international commitments to reduce greenhouse gas emissions. To reduce our emissions, we need to transition rapidly away from the use of coal, oil, and natural gas to clean, safe, and renewable energy and energy efficiency, including through electrifying our vehicle fleets and creating distributed energy systems. This would substantially decrease air pollution that already kills more than 100,000 people each year in the US. It would reduce fuel poverty and increase resilience in the face of climate-related extreme weather events. If we emphasize active transportation, walking, biking, and public transit, we'd see a huge decrease in chronic illness, obesity, osteoporosis, cardiovascular disease, diabetes. We can use regenerative agriculture and localized food systems to increase affordable, healthy foods, decrease red meat consumption to reduce methane and heart disease, reduce illnesses associated with water contamination from fertilizer and pesticides. We know that water is a human right, and it's clear now how important it is when literally hand washing can save lives every day. But we need to ensure access to clean drinking water as heat and drought become ever more prevalent. And if we want to make sure that we really address longstanding health and social inequities, we must invest in policies that support a just transition for workers and communities adversely impacted by climate change and the transition to a low economy. Next. Our second bucket is health action for climate. Extinction Rebellion, a group that started in the UK that uses nonviolent civil disobedience to push for climate action, has 3 demands. And the first is tell the truth. Who better than the health sector to call for climate action and call out the true human impacts of the climate crisis? To do that, we really need to launch something like the kind of campaign that we had with tobacco, where we use media advocacy coupled with community-based coalitions to really lead significant change in policy. We also need to put our own house in order. Hospitals and healthcare systems can green their operations, reduce the emissions embedded in their purchasing and supply chains, and build greater resilience in the healthcare system. And we can all work with community residents and community partners to support efforts to build healthier and more climate resilient communities. Of course, none of this will happen for free, so our 10th priority is to invest in climate and health so all of the above can happen. We're seeing firsthand now what years of disinvestment in public health means. We need to make sure our public health and healthcare systems have the resources and capacity to address climate impacts. Next. When we launched the policy action agenda in June of last year, over 150 national and regional health organizations representing millions of health professionals endorsed it. And we're asking now that you endorse as individuals, and we'll talk more about that. It's not just health professionals that are supporting climate action. About 2/3 of American adults say the government is not doing enough to address the threat of climate change. Next. So why aren't we seeing the change that we need? I think it's because while we have the science, the know-how, the technology, the wealth to make the requisite changes, we don't yet have the political and social will to do so. And in large part, that's because of very intentional efforts to sow doubt about the need for climate action and to spread fear about climate action consequences. Next. Some smart person said that COVID is climate change at warp speed. That might be true, but it doesn't change the physics of climate change, the increase we're seeing in carbon dioxide over year to year, month to month, nor the need for urgent action. Next. And it doesn't change the underlying dynamics that make it critical that we address racial, social, and economic injustices. We're seeing the same communities that are impacted by climate change disproportionately impacted by COVID. Next. But the response to COVID has, I think, the potential to really significantly change public perceptions in some very important ways. For example, we've seen a remarkable cleaning of our air, next, and a reduction in CO2 emissions, next. And for me, one of the most remarkable things about COVID is that there seems to have been a shift in the entire national dialogue about whether access to housing, food, electricity, water, and healthcare are human rights and a shift toward recognizing the worth and dignity of every human being. And you can see here, policymakers all over the country are implementing policies that do recognize that we're all in this together. So our COVID response is proving that large-scale, rapid, transformative collection action across geographical, cultural, and political boundaries is not only necessary in confronting potentially catastrophic events, we also can do it. Next. So I want to quickly talk about some of the lessons we might try to carry forward when we emerge from the acute crisis of COVID. Yes, COVID is a health emergency, but so is climate change. And just as we must take action to address COVID, failure to take action on climate change will lead to immense human suffering. I think people are getting a lesson that science matters, that the exploitation of nature has consequences for humans too, that prevention and early action matter. We have a window of opportunity in which to forestall climate chaos, and missing windows of opportunity we now see has real consequences. We are all in this together, and we can make large-scale, rapid, and transformative change if we act together to do it, and we can do it. Next. When people like Mitch McConnell support some version of universal basic income, even if temporarily, it makes one wonder if we can, in fact, muster the political will for a just transition and the climate action that we really require. Next. However, we're seeing things in the midst of the coronavirus pandemic that really anger and frighten me. Just this morning, a new study from Harvard showed that even small increases in long-term particulate matter exposure are associated with large increases in the COVID-19 death rate. But right in the midst of this health crisis, the administration continues its long-planned, malevolent, dangerous efforts to unwind 50 years of environmental protection and continue us on our path to climate ruin. Next. That's why the health voice is more relevant than ever, and it's why our action as health professionals is more important than ever. Yes, we must devote our energy and our resources right now to getting through the worst of this immediate crisis, but we're not off the hook from doing our best as health professionals to promote and protect health in the face of the looming global climate health emergency. Let's learn from each other, let's work with each other, and with that, I want to thank you again. Ask that you go to the website next and endorse the call for action. Work with us to fight like our lives depend on it for healthy people, healthy places, and a healthy planet. I'm going to turn this over next to Sarah Spengeman, who is the Director of Communications and Advocacy for Healthcare Without Harm. Thanks.
Hi, Linda. Thank you so much for that wonderful overview of the challenge that we're currently facing from both COVID and climate change. So thank you so much for passing it over to me. Like Linda said, my name is Sarah Spengeman, and I'm the Associate Director for Climate and Health. Next slide, please. Healthcare Without Harm is a global environmental health and justice organization that was started in 1996 as a coalition of many different organizations who came together to tackle specifically the harmful emissions that were caused from medical waste incineration. And that global campaign has been enormously successful. But over the past 5 years, as our organization has recognized that climate change is really the overarching environmental health and justice issue of our time, it became increasingly the focus of our organization. And we work to foster climate smart healthcare in hospitals and to help leverage the trusted voice of the healthcare sector to reframe the climate debate to focus on health. Next slide, please. Although healthcare has a healing mission and from the name of our organization has the responsibility to first do no harm and a commitment to do no harm, the healthcare sector nevertheless contributes significantly to climate change and to the very illnesses, diseases, and other harms that healthcare is aiming to prevent. Healthcare in the United States contributes approximately 10% of total US greenhouse gas emissions, and hospitals, as they're incredibly energy intensive, make up about 1/3 of those emissions. If the US healthcare sector itself were a country, it would be the world's 13th largest emitter of greenhouse gas emissions. Next slide, please. Last fall, we conducted a report looking at the global carbon footprint of the healthcare sector. And what we found is that globally, the healthcare sector makes up about 5% of global carbon emissions, and that if healthcare continues on its trajectory of business as usual with an annual growth of about 3.8% per year, then healthcare's carbon footprint is going to triple between now and 2050. And so that is something we cannot abide. We are going to actually solve climate change. Healthcare has to reduce its own emissions and take responsibility for its own impact. Next slide, please. We also know that hospitals and healthcare providers are serving on the front lines of climate change and are expected to be first responders. Hospitals are expected to be the last building standing in case of an emergency, and climate change is making that increasingly difficult. When we think about the summer that we're facing in 2020, we're facing a summer where we're going to see likely another record hurricane season, fire season, record extreme heat, drought, floods, etc. And our hospitals are going to be grappling with that extreme weather and trying to serve their communities at the same time that they are burdened and overwhelmed by COVID. And so we have to support our hospitals and respond to climate change in a way that ensures that our hospitals are able to care for our communities. Next slide, please. So Healthcare Without Harm's Climate and Health Program has devised a 3-pillar strategy, and our 3 pillars are overlapping and they're integrated strategies because they all reinforce one another. We work with hospitals to reduce their carbon footprint of their operations. We work with hospitals to help them prepare for the impacts of climate change and to be anchors for resilient communities. And then we work with hospitals and leading healthcare systems to show on climate change and to help accelerate the clean energy future. To give you a quick example of how these are overlapping, think about energy efficiency. By a hospital reducing dramatically their energy use, they are to reduce their carbon emissions, but they're also able to operate for longer on backup power, and that makes them resilient. And leadership is essential to securing policies that provide strong energy efficiency resource standards for states, which give hospitals the very incentives that they need to be able to actually do the work. Next slide. Our Share Climate Challenge is our primary campaign for advancing climate smart healthcare here in the United States and globally. And when a hospital healthcare facility commits to the Healthcare Climate Challenge, they're committing to showing leadership in each of those 3 areas, in mitigation, in resilience, and in advocacy leadership. Next slide. And in the United States, health systems are increasingly recognizing their responsibility to address their own impact and to prepare their facilities for climate change. Here's just a snapshot of the greenhouse gas emissions and renewable energy goals that leading healthcare systems across the country are setting. Kaiser Permanente, for example, will be carbon net positive by 2025. Pretty exciting. Next slide. The impact of those health systems that have committed to the Healthcare Climate Challenge is demonstrable. We're seeing that from the goals that have been set, there will be an avoided 34 million metric tons of carbon emissions per year. That's equivalent to taking 9 coal-fired power plants offline. Next slide. We also have convene a leadership body called the Healthcare Climate Council. It's made up of 19 leading U.S. healthcare systems, and they have committed to not only reducing their own impact and innovating climate solutions, but also urging the entire healthcare sector to act, and also to working with policymakers to accelerate policy solutions. Next slide. And before I close, I just wanted to give you an example of how the Healthcare Climate Council has been using the call to action to advocate for climate solutions. Just last fall in October, the Healthcare Climate Council went to Capitol Hill and met with members of Congress to talk about the call to action, to talk about the impacts climate change is having on hospitals and on health in the United States, and to call for 100% clean renewable energy by 2050. Recommendations for how policy could help hospitals support the transition. And our Health Climate Council is not just advocating on Capitol Hill, they're also advocating in states across the country like Wisconsin, New Jersey, California, Massachusetts, Virginia, Ohio, Washington, Florida, and many other places. So if you have any questions about whether or not you're a member of the Healthcare Climate Challenge or information about the Healthcare Climate Council, you can reach out to next slide. And thank you so much.
Great, thanks, Sarah. We wanted to provide time for Q&A throughout today's webinar. We've been getting a lot of questions about the relationship between climate change and COVID-19, the current coronavirus pandemic. And so I know that Linda had started to touch on this in her remarks, but Linda, do you want to say a few more things? There were questions about learning from risk perception that we're experiencing now, any explicit link between climate change and the current outbreak, and some equity implications. And so I just didn't know if you wanted to take just a minute here to expand on the comments you've already.
Sure, and I'll preface that by saying that emerging infections are not my area of expertise, but we do know that there are things that contribute to climate change and to the emergence of novel infections. For example, deforestation, big contributor to climate change and also a significant factor in increasing human-wildlife interactions. And we know those interactions do contribute to the emergence of novel infections and probably had a role in the emergence of COVID as a global pandemic. We also know that in many parts of the world, we're seeing climate change contribute to the spread, not of new diseases, but the spread in novel ways of vector-borne diseases. So I think that there's many other links between climate and emergence of novel infections, but I will leave it at that.
Thanks, Linda. And then one more question before we go to the next presenter. It's for Sarah. And the question is, to what extent are hospitals and hospital systems and their related endowments invested in fossil fuel companies?
This is Sarah. That is a good question. Unfortunately, healthcare sector is behind in terms of divestment. And so, we do really need healthcare leaders to call for a divestment in the healthcare sector. And we do know that there are holdings with fossil fuel companies by healthcare institutions. So a couple things we have done is we have put together a resource actually for healthcare leaders to look at their own retirement and work with their human resources departments at health systems to help shift the retirement offerings to be fossil fuel free. And then you're also actually working on a fact sheet right now to help people understand about how to move divestment forward with their healthcare system. So we'll be happy to follow up with anybody about that specifically.
Great, thank you, Sarah. And now over to our next presenter, Mona Sarfati.
Hi, thanks very much, Rebecca. I would just like to add one more thing to the first question. which is that there's an epidemiologist at Harvard who just ran some data and showing, based on air pollution levels at thousands of counties around the country, that places that have more polluted air are getting into more trouble with COVID-19. And so that's something that, also shows a connection that we'll definitely want to think more about. In any case, thanks very much. I really want to talk about building consensus for moving forward. I'm a family physician and also public health physician. And the main message of my very brief talk is the importance of building consensus so we can be effective in addressing climate change. A few years ago, we surveyed physicians around the country about climate change and found there was a high degree of awareness and concern and a desire to do something to address the problem. This led to the founding of the Medical Society Consortium on Climate and Health. The consortium is now comprised of 29 medical societies, representing together about 60% of all the physicians in the United States. There are also 44 affiliated public health groups that have millions of members. The mission of the consortium, you can see this on the next slide, is to organize, empower, and amplify the voices of America's physicians and other health professionals to educate the public and policymakers on how climate change is harming our health and how climate solutions will improve it. Specifically, on the next slide, you can see when it comes to organizing, not only are we organizing societies and affiliated public health groups, but also climate and health advocates who are individual health professionals who are advocating for climate solutions. We're also supporting and assisting state-based clinician groups to focus on climate and health policy at the state level. The next slide, with regard to organizing and our efforts to build consensus. About a year ago, we held a strategy planning meeting at our consortium annual meeting to talk about how we could advance the policies and the policy action agenda. And we subsequently brought together a group of several health associations to launch the call to action with a press conference last June. On the next slide, you can see a couple of the individual climate and health advocates, one from Florida, the other one from Virginia, both speaking at rallies advancing climate solutions. And the following slide shows the Vermont-based climate and health group, which is at the State House and advocating together for climate solutions in Vermont. On the next slide is a picture of our webpage, and you can see in the upper right-hand corner there that we're calling for advocates for climate and health. And you can sign up and record activities that you do as part of your advocacy. On the next slide, you can see that when you record these activities, they'll show up in real time in either as presentations, policy activities, or media activities, depending upon what you log in. And then when you refresh the screen, you'll see a real-time uptick in the number of activities that show there. And there are about 1,200 that have been logged in so far. And we're very much trying to show just to what extent the medical community is working to advance climate solutions. On the next couple of slides, you can see images of the work that went on at the annual meeting last year. It's almost exactly a year ago, to try to figure out how we could advance the policies in the policy action agenda. Next slide. We also work to empower, and that means deepening the commitments to the points on the policy action agenda through this webinar and other advocacy efforts. And we're also trying to build consensus among medical societies on vital EPA policies, i.e. regulations. In the past, medical societies did not always weigh in on EPA regulations, and increasingly we're able to do that as a group. We're trying to create greater commitment to environmental justice as a core concern of climate work. And we offer private communication training for policy visits and try to align members and affiliates on messaging. On the next slide, we mentioned that we've got a very active website. And on the website, we offer talking points, advocacy templates for letters to the editor, and op-eds. And we put out a monthly newsletter that offers action alerts, climate and health news, and also resources and events. On the next slide is a picture of two advocates from Georgia who are visiting their congressional offices at the time of our annual meeting last year. And at the annual meeting, we try to visit Congress state by state. And then the next slide shows the Virginia group also making visits at that time to one of their legislators on Capitol Hill. And the next slide describes some of what we do as a part of our amplifying efforts. There were 450 stories about the policy action agenda that were published last year in June after it was announced, thanks to the help from Climate Nexus, which is the national pro bono public relations group that helped us to get those stories out there. But most of them focused on the fact that we all agree that climate change is a health emergency and said very little about the specific policies in the action agenda. We also have a public relations effort specifically for the consortium and its efforts, and there have been about 350 media stories over the last few years. And we continue to have op-ed campaigns, letters to the editor, have an active social media presence as well. The next several slides show pictures of advocates, or I should say clinicians at their annual meetings. We've gone to those annual meetings and exhibited and tried to engage them in using social media to advocate and pledge for what they will do to in the interest of climate solutions. And you can see on this one, you have somebody supporting Meatless Mondays, somebody else composting, somebody else advocating, and other individual talking about turning off, pledging to turn off the lights. On the next slide, you can see a few more of these with the gentleman on the right advocating for carbon fee and dividend policies, and so on. And the next slide shows a banner that we have at our exhibits at these annual meetings. And this is very individually oriented, what people can do now to address climate change. We find that increasingly the people who attend these meetings are asking us, what can I do? What can I do? And so we are trying to give them answers. Finally, with the next slide, we hope to advance the policy action agenda. As we address the pandemic of COVID-19, we're very aware that the climate change health emergency is still with us, and that COVID-19 presents a crisis and great danger, but also an opportunity, and that health messengers will be even more important now than they were before. We need to advocate for a better functioning society and not one that merely gets us back to normal. Thanks very much.
Great, thanks so much, Mona. This is Laura Kate Bender. I'm the National Assistant Vice President for Healthy Air at the American Lung Association. And the Lung Association's mission is to save lives by improving lung health and preventing lung disease. And a big way that we do that is by mitigating and addressing climate change. So I'm just going to talk in a little bit more detail about current opportunities to engage our federal leaders by educating them about the links between climate change, air pollution, and health. So first, I'll just dive into a quick overview of where we are on Capitol Hill with the US Congress. I'll say at the top that I think the chances are next to nothing that Congress passes comprehensive climate legislation this year. That is, that in 2020, Congress will get a bill across the finish line or a series of bills that fully addresses climate change and its health impacts. But there's still hope for a couple reasons. One, as Mona mentioned, Congress is taking urgent action around COVID-19, and there are certainly ways that we can use those opportunities to advocate for solutions that not only address the current public health crisis, but set us up better to address future public health crises, including those caused by climate change. We also know that Congress has other things they need to pass, such as funding bills, there will be more opportunities for us to invest in reducing air pollution and greenhouse gas emissions. And finally, even though Congress might not be ready to get something comprehensive across the finish line, the conversation is in a much better place than it was a couple of years ago. And I really think that's in large part thanks to the advocacy of people like you. So in the last couple of years, we've seen every single committee in the House of Representatives hold a hearing on climate. The House stood up a select committee on the climate crisis. They have held a bevy of hearings, including one specifically focused on health and equity with regard to climate change. They also have been tasked with releasing a big policy report that lays out all the different things they think Congress should do on climate. The release has been delayed due to the COVID pandemic, but we'll see it soon. We've seen other committees write their own climate plans, and we've seen a variety of members of both the House and Senate introduce bills that would be their solutions on climate change and circulate them for discussion. So the discussion is happening. Next slide, please. And that means it's a perfect time for you to reach out to your members of Congress, if you haven't been already, to educate them about the policy action agenda and our priorities as the health community working to act on climate change. So the first thing I'll share here, this link, which you'll get when you get the full slide deck, is the Lung Association's Legislator Lookup tool. You can use lots of tools, not just ours, or house.gov. But essentially, the people that you will have the most impact with are your 2 senators from your state and your House member in the House of Representatives. They are accountable to you. When you call offices, you can leave recorded information, an opinion for their staff for them to go through later. That's certainly always a good thing. But even better, you can actually ask to speak with the staffer who handles environmental or health issues. And you can set up a relationship with them. You can email them to connect them, to share the agenda, to share your personal experience treating patients or living and working in a community that's experienced climate impacts. You are an expert as a health professional or a health expert. And so you have information to share with congressional staff that they'll find helpful as they work to address this issue. Next slide, please. We also have opportunities right now to weigh in with the U.S. Environmental Protection Agency. Mona mentioned that regulations are a critical part of reducing air pollution and reducing the impacts of climate change. And unfortunately, even as we're working together to lay the groundwork in Congress to educate them about what needs to be done to move forward, of course, we're seeing the federal government move us backward. So right now, before the U.S. Environmental Protection Agency, EPA, there are 2 opportunities that I'll quickly highlight. One is that EPA is currently taking public comments on a proposal that they have out to restrict the science that they use in their decision-making. And I think we can all imagine that that would not be good for future climate change or air quality standards. You have until May 15th to submit comments at lung.org/savescience. We'll have that again at the end. And I know that a lot of our other organizations in the line also have action opportunities around this item. And then I'll also point out that on April 21st, the Lung Association will be launching its State of the Air report for 2020. It's our annual look at clean air and levels of ozone and particle pollution across the country, and climate change always plays a big role in the results of the report. We'll also be launching an action opportunity to push EPA to set stronger standards for air pollution, which of course, we're not only seeing increase due to climate change, but also the same sources that are emitting harmful air pollution are emitting greenhouse gases. So look out for that on April 21st. Thanks so much, and now I'm going to pass it over to Helen Pham, who's a senior nursing student in New York.
Hello, everyone. My name is Helen Pham. I'm a senior in the Barbara H. Hagan School of Nursing at Malloy College in Rockville Center, New York. In nursing school, we're taught to advocate for our patients, especially for the most vulnerable. Sometimes this means advocating within the healthcare system to get them the best possible care. And sometimes this means advocating for policy and systematic change to prevent them from getting sick in the first place. I understood these values early in my education. In my first year of college, I felt it was important to start advocating during undergraduate studies because it sets a foundation early on. I wanted to make a difference not only at the bedside, but on a larger scale. I used my positions as president and then community health director on the state level of the National Student Nurses Association to focus on environmental health and advocacy. My most recent work has been organizing beach cleanups for nursing students across Long Island and for students at my campus as part of our Sustainability Week last month. The negative effects of global warming directly impacts human health, which is why climate action is important to me as a future registered nurse. Next, please. On September 20th, 2019, 3 days before the UN Climate Summit planned to meet, I participated in the climate strike in New York City with Greta Thunberg. My younger sister, Brittany, joined me too. She's 14 years old in the photos next to me. We had never been a part of something so big before, and over 3 million took the streets of New York City, and that was before we even began marching. The passion of Generation Z is contagiously inspirational. It's a youth building movement, and it's imperative to remember that these students are the future. Next slide, please. Last December, I took an Amtrak down to Washington, D.C. to participate in Hill Day and the hashtag Fire Drill Friday strike with Jane Fonda. With the help of the Alliance of Nurses for Healthy Environments, I was able to meet with my Congressman, Thomas Suozzi, in the bottom left photo, and Congresswoman Lauren Underwood, who is also a registered nurse, top left photo. We visited elected officials to share the policy action agenda. As a soon-to-be registered nurse, it's incredibly important for us to advocate for a transition to clean energy. Clean energy doesn't just have benefits for the climate, but also benefits for public health. Clean energy reduces harmful emissions and improves air quality, which has the potential for a decline in respiratory issues for people. And so by transitioning to clean energy, we work to ensure that the health of the most vulnerable populations is being looked after. When we visited the Hill, we've asked the House of Representatives to support the 100% Clean Economy Act of 2019, which at the time was in the beginning stages in the House. We also asked for senators to co-sponsor the pending companion bill that was set to be introduced in the Senate as well. Finally, in February 2020, Senator Carper introduced the Clean Economy Act companion bill in the Senate. This was my first time meeting with elected officials, and to have them listen to my opinions in regards to climate, health, and social injustices was such an invaluable experience. Hashtag Fire Drill Friday, Health Can't Wait, was a different strike than the youth-led strike in New York City. This time, registered nurses from all over the country came together dressed in white lab coats and red berets to represent our profession, as seen in the top middle photo. This was my first-hand account of how powerful registered nurses could be when banding together with one voice, and this lit the fire in me even more. It made me more excited to join the nursing profession more than I could ever imagine. One of my favorite moments was meeting this adorable 2-year-old in the top right photo wearing a shirt, "Vote to Protect My Little Lungs." Connections made at experiences like these are life-changing. In my 4 years of nursing school, I hope that my work has inspired others to make an impact. Whether it is inspiring them to run for a leadership position on the local, state, or national level to gain a platform, or having meaningful conversation about climate actions after a day of cleaning up the beach. It's important for students to get involved in any form of advocacy as early as possible. And who knows what opportunities and experiences will spark a fire inside them. Thank you. Now I'm pleased to hand the mic back to Rebecca to facilitate some Q&A.
Thank you so much, Helen. We've gotten a couple questions about, and thank you already to our panelists for chiming in on the Q&A function and providing some great links, and to all of our participants for asking great questions in the chat function and the Q&A function. I was just wondering if any of the three of you wanted to comment on additional resources for students wanting to get engaged. And in particular, are you working on any curriculum materials in medical or health professional education? And to any of those three panelists, if you'd like to answer, just remember to unmute yourself.
For nursing students, a great resource that I've been very involved with since I started nursing school is the National Student Nurses Association. They have many agendas, and it changes every year based on past resolutions that are voted on in the House of Delegates. If you want to visit their website, it's www.nsna.org.
Thanks so much, Helen. Okay, now we're going to move along to the next speaker. Great, so I'm pleased to turn it over to Emily York.
Hi there, this is Emily York, and I chair the Healthy Environment section of OPHA, which is an almost all volunteer-run state affiliate of APHA. Next. OPHA knew that climate was going to be top of our governor's agenda, and we wanted to make sure that this year's policymaking discussions also included discussions around health. So the call to action was a perfect platform for us to use. It meant that we didn't need to start from scratch. We used the 10-point policy framework that Linda talked about at the beginning of this presentation, and we tweaked it fit Oregon's local policy. We launched the call to action at our association's annual meeting in October, and we had an online Google form that made it really easy for health professionals to add their name using laptops at the event. The call to action provides a broad policy framework, and it doesn't require that signatories formally endorse any specific legislation. And that we found out was really important to people because many health professionals and health organizations can be wary of taking political positions, or in some cases, they may be prevented from doing so. So as we moved forward, we proactively communicated that by signing on, people were joining voices with other health professionals around the world to declare climate change a public health emergency, and that they weren't endorsing any specific bill. Next, after our annual meeting, our efforts to gather partners moved mainly online. We started by looking at the organizations that had already signed on at the national level and also in California, and we considered whether there were affiliate organizations here in Oregon. In December, we were able to we didn't hire, it was a volunteer intern who joined our team. This was all done actually with volunteer time and the support of the executive director of OPHA. Our intern really helped us keep organized. And then as people and organizations signed on, we updated our webpage to reflect the growing support. So in early 2020, not too long ago, the governor here in Oregon convened a roundtable meeting with health leaders on the topic of climate change. We can't be sure that our call to action influenced her decision to do this, but it may have helped. OPHA's ED, Jessica Nishlong, was there to invite everyone around the table who hadn't already signed on to join our call to action. Next, our initiative gained momentum and it was time for us to make that known. We now had 500 individuals and over 40 leading health organizations. OPHA was planning our annual lobby day at the Capitol building in Salem, so initially we planned to have a climate and health press conference at the same time. However, as we move forward, we learned that the biggest opposition group to climate policy in our state would be holding a huge rally on the same day, and that our press conference would be overshadowed by a cloud of greenhouse gas emissions as thousands of freight trucks were predicted to be circling the Capitol building that day. So we decided to hold it a few days earlier in Portland. Next. OPHA's executive director, shown speaking here, was joined by 3 other excellent spokespeople. Lead health officer for the Portland Metro Tri-County region, Dr. Jennifer Vines, Izzy Ventura Meda, executive director of a community-based organization called Familias en Acción, and Dr. David Pollock, co-founder of Climate Psychiatry Alliance. And next, this is just a quick side note or plug to let you know that Dr. Pollock will actually be speaking on another webinar this Friday on how the current pandemic can help us prepare for population-wide mental health effects of the climate crisis. And we'll include the link in follow-up. It's also on APHA's calendar. So next, our press event was a huge success. Our state's public broadcasting picked it up, along with Fox News, other local media outlets. We were then able to use all of this attention and the call to action to further discuss climate and health priorities with legislators in the days that followed. Next, the climate bill sausage making was in full swing with over 100 proposed amendments. But as many feared, the same legislators who walked out last year once again disappeared, leaving many important bills hanging unfinished without quorum and thus without a vote. With some of these lawmakers' seats empty, the Oregon House of Representatives Committee on Healthcare held a hearing on climate change impacts to health. It was the first time that they had met on the topic. Later, after the session was over and the climate bill had failed to pass again, the governor issued a set of executive orders on climate action that included several new public health directives. Next. Our intern has put together a brief summary report that goes into more depth about our successes and lessons learned, and we'd love to share this and have others in states across the country launch your own call to action initiative. Our next steps are to survey all those who signed on here in Oregon and see how they would like to continue to engage. Now I'd like to hand it off to Lalita Sarapanini.
Hi, thank you so much. My name is Lalita Serpanini. I'm an assistant professor in medicine at the University of Minnesota. I will be primarily speaking in my role as an executive committee member of health professionals for a healthy climate in Minnesota. Next slide. I'm glad that we took some time to talk about COVID because I'm actually at the hospital about to start my shift now. So it's very important that we focus on both of these crises. Our group is a interprofessional group with doctors, nurses, public health advocates. We have hospital administrators, and our approach is that we need everyone to be in this to create climate action. Next slide, I wanted to talk about the various ways in which we're approaching this. So we host conferences. We were actually going to have one in early April that unfortunately got canceled, but it's called Code Blue for Patient Earth, and we discuss the health impacts of climate change and review the latest evidence, and this is actually open to the public. We also have publications in peer-reviewed journals and medical magazines, and have a climate and health journal club as well. Next slide. And this is a student group called Health Students for Healthy Climate. They are the link between my role as a university professor. I'm their faculty advisor, but then with the students, we're able to work with health professionals and other community organizations to do translational research on climate, health, and equity. And this was from the September climate strike. All right, so we can move to the next slide. We are also organizing various health organizations within our state, including, once again, keeping it interprofessional. And this is a declaration that we developed on climate change and health specific to Minnesota, highlighting the health impacts we are going to see here. Next slide. And advocacy was kind of where I was going to spend most of my time. So we have been involved in various issues, and we take guidance from the U.S. action on climate and equity. So a couple of them to highlight in the past year, things that I worked on. So we are all aware of the Volkswagen scandal with their diesel emissions. So our state was awarded money, and this is a report that I wrote on the health benefits of electric school buses on children and health harms of diesel. And we did a lot of grassroots organizing within the healthcare community and submitted comments. And through our efforts, the Pollution Control Agency has granted us $4.7 million towards the electric bus program. We also organized a teach-in on the health harms of a pipeline. This is a tar sands pipeline coming from Canada through Minnesota, very similar capacity to the Keystone XL pipeline called Line 3. And I actually put that in the chat that currently the Pollution Control Agency is taking comments on this pipeline. So the deadline is April 10th. We're also reaching out to media and making sure we continue to emphasize the message that climate change is a health emergency. The kind of big takeaways that I've had over the past year of working within Minnesota is that having a community is the most important thing to help move action forward. But even more than that, what I've realized is that health professionals need to show up. I used to think that if we have the research, if we do if we have the science, that's enough. Then I thought, well, we're gonna learn how to communicate science in a manner that's palatable and speak with media, but as we know, the environmental rollbacks continue, and what I've found is that it's very effective whenever there's a public forum for health professionals to take the time to come and speak with elected officials directly, and that does change the conversation. So thank you so much, and I'll turn it over to Martha Dina Arguello. Thank you.
Good afternoon, everyone. I'm Marta Dina Arguello. I'm the Executive Director of Physicians for Social Responsibility. And for the last 20 years, we have really transformed our chapter into a physicians organization that uses, and nurses and public health professionals and community members, who is committed to using the credible voice of physicians to stand with communities who are directly impacted by whether it's air pollution, toxic land use, brownfields, pesticides. And so we've worked as a movement organization, very tied to the environmental justice movement in California and nationally, where we have really, the understanding that the fundamental demand of people, of communities living on the front line, has been about health. And we've also understood sort of the elasticity of the health frame to be able to be an organization that's nimble and can stand with communities. So I use that term because our coalition, Standing Together Against Neighborhood Drilling, actually came from a community member calling us and saying, folks are reporting these sets of illnesses, can you help us find out? And that very first phone call, I knew that I would be working on this probably for the next 10 or 15 years in Los Angeles, when we realized that how much oil drilling was actually happening and that we actually have no data. So the way our policy making works is that we use data, and right now even that is under attack. And so as we fought to make sure that folks understood what the health impacts were and that we had alternatives, many of the same groups that were part of the Standing Together Against Neighborhood Drilling came together to form the LEAP LA, which is really based on Naomi Klein's book about we need to leap to a caring economy and away from this extractive economy that we extract fossil fuels and we extract value from people. And how do we move beyond that? And so the LEAP is, I say, really brought together the imagination of frontline communities that you see here listed, to work together to figure out what does a transition look like in Los Angeles, and how, if Los Angeles, the hallmark of it is its lack of permanence. How can we go from a city built on oil to a city built on justice? And so we, next slide. So we came together to say, we created the first climate emergency mobilization department with equity at the center because it was frontline communities, and we've built into the management of that department a frontline caucus and community advisory committee made up of communities who are ranked high on CalEnviro Screen's Disadvantaged Community Index, which looks at 19 measures of inequality and vulnerability. Next slide. And so we, because we fundamentally understand that we have deep systems to change, and that if we're going to address root causes, we have to address the one role of race and the role of capitalism in creating health inequalities. But we also understand that when you win locally, you can also translate that into bigger wins. So we've also created a coalition throughout the state of California, where we've been at the center of helping with the strategy and also bringing health voices to that debate. And it's Voices in Solidarity Against Oil in Neighborhoods. And we now have a bill moving through Sacramento that would create a regulatory process to enact 2,500-foot health and safety buffer zones around all oil, which mirrors the demand that Standing Together Against Neighborhood Drilling is doing in Los Angeles. Next slide. We also work, again, coalitions. The Last Chance Alliance is a California coalition working to keep fossil fuels in the ground through, one, not issuing any new permits, figuring out how we do a managed decline of fossil fuel, both supply and demand, and then lastly, rolling out setbacks. And this coalition, when we started working on this, maybe 10 years ago as an organization, our role was vital in bringing the credible voice of physicians and public health communities to this idea that our policy should also first do no harm, that it is not, it is an unsustainable practice to be drilling for oil next to where people live. And when I say next to where people live, imagine your front or your backyard hosting a storage facility or an actual drill site. That's how close proximity the practice happens in LA. So we have been able to leverage, next slide, the physician voice in a number of campaigns, but particularly in this campaign to make the conversation even possible, that we can keep oil in the ground and have a just transition in California. Had it not been for that, our ability to leverage that powerful health voice, I don't know where the campaign would be, but it's been a really central part. This is another campaign we did around fracking secrets. This was a number of years ago. And again, we were able to engage at the policy level, but we've also, the use of creative communications in media that's strong, that calls for what's needed, has really been at the center of our ability to work in trusting relationship and in right relationship with environmental justice communities. And our feeling is that we should be taking our cues and leadership from those frontline communities who are clearly the most impacted but have the solutions. And I think when you think of who's being most impacted by COVID, and the stories are coming out for African American communities, we know that that at the core of that is systematic racism. And as an organization, as staff, we actually come from communities who are impacted in Los Angeles. We sometimes were very scared to talk about this with our physicians. We didn't know how they would approach it. And in 2016, we were approached by a number of physicians who are in teaching positions, but residents, and they wanted to do a conference called Don't Mow and Organize. And at the center of that was understanding the role of race and racism and systematic racism in health outcomes and in health disparities. And that was a transformative moment for our organization, next slide, where we were able to tap into a network of really progressive physicians who are ready to be bold and courageous and have done everything from op-eds. These are nurses and doctors doing visits around in Los Angeles around the setbacks. We've been able to create relationships with the CNA, and so, which is the California Nurses Association, as well as Alliance of Nurses for a Healthy Environment. But we are all collectively working toward a health-based just transition to a new economy. And so this is a bit of the coalition work that we're doing that is all threaded together with that idea of how do we put justice at the center of our economy, and the result of that is better individual and community health. Next slide. That's it. Those are some of our sister chapters there, as well as ours.
Thank you so much, Martina, and thank you so much to all of our speakers. The presentations were meant to provide information for you on what is happening around the policy action agenda and ideas that you can model. There are tangible ways to put forth the actions in the policy action agenda once you've signed. So we want to open it back up to some Q&A. So please feel free to use the chat function and this will be for any of our speakers. We'll spend a couple of minutes. So I want to open it up and anyone can jump in here. We had a number of questions about the health disparities in climate change. So climate change is a risk multiplier for health and was one of the social determinants of health. Some areas have more toxic pollution than others, like near coal plants, fertilizer runoff, etc., which increase carbon dioxide and other greenhouse gas levels, and their health is negatively impacted as a result. What initiatives or training are being conducted on addressing this fact?
Well, I'll start by saying I totally agree that climate change is a threat multiplier for virtually all of our biggest health problems, and that it disproportionately impacts low-income communities and people of color, and thus exacerbates existing very stark health inequities. And that's why the call to action explicitly addresses equity as a central component in climate action. I think all the groups that are speaking on this call are working to simultaneously try to promote climate action and address health and health equity. And we're hoping that the policy action agenda helps us to do that more cohesively, and that we can mobilize the health sector to advocate and use our voice to advance health equity and climate action at the local level, at the state level, at the federal level, and at the international level. And we think that one of the best ways that we can do that is really to inform policymakers and the public about why we need climate action, why and how climate disproportionately impacts communities that have historically been marginalized and disinvested in, and use our voice to build the political and social will for a more just, sustainable, and healthy communities across the country.
This is Laura Kate at the American Lung Association. I'd love to follow on to that quickly to say, I think this question is a great example of why it's critical that we don't just have policies on the state and federal and local level that address climate change, but that they do it in a way that maximizes the benefits to health. Because there are climate policies that could reduce carbon emissions overall, but we could see that some communities don't see the cleanup that they need to. And then of course, not only does that reduce the overall impact to carbon emissions, but it also means that, say a polluting power plant might buy offsets instead of cleaning up, and it would continue polluting the community nearby. So the Lung Association has made as a central core of our climate advocacy the idea that we need to be maximizing the cleanup in an equitable way across those communities, because the way this works best is if we reduce all emissions at the same time, and that we use it as an opportunity to close the facilities that have been in large part the sources of these problems.
And if I could jump in there, this is Mona. It's one thing to understand this and to promote understanding of it, which is vital, but it's also true that partnership is essential for taking these issues forward in a way that actually reaches policymakers and make change. And there are a lot of environmental justice organizations out there which may currently, may or may not be integrated into the other efforts that are on to promote health in the face of climate change. And we really need to reach out to those organizations, find out where they are, and partner with them, make active attempts, go to their meetings, get in touch with them, make active efforts, engage, work with them so that we can build the kind of partnerships that are needed so that all the perspectives are represented when we go forward, and so that we really do make sure to make this a core part of our concerns around climate and health.
Great, thank you. And I think any of our websites, and we included several of them throughout the presentation, have resources from each of our organizations that supports not only the information you need to be able to talk about climate change as an equity issue and talk about the compounding effects that climate change has on those already suffering from a number of different social and economic determinants of health. And the moving forward guide that I mentioned earlier from Climate for Health does so right in the beginning, and is a companion piece for our Climate for Health ambassadors training program that embeds equity in how we talk about climate change and how we work on solutions. And we do that alongside our partners, many of which are on the phone today. We had a specific, yeah, go ahead.
One more thing, Rebecca, was just that the Climate Health Action site is currently accommodating individual signers to the policy action agenda. So individuals can now go to that site, climatehealthaction.org, and sign up to show that they personally support the agenda. Thanks.
Excellent. Thanks, Mona. We did have a specific question within talking about inequities and talking about disproportionate impacts. If there are specific resources that you know about for rural communities.
Obviously a good question. If you, I think that there's issues around climate and health that are particularly germane in rural areas in California. Obviously, two critical issues are wildfires and water access, where many of our rural communities here don't have good access to clean drinking water. And there's a lot of information about both of those issues.
If I may, this This is Marta. I don't know too much outside of California, but a number of groups from, Californians for Pesticide Reform are working around soil health and regenerative agriculture in the Central Valley. There's a group called Leadership Council for Accountability, and they're working with many rural communities around everything from air quality to land use issues. There's also the Center for Race, Poverty, and Environment that is working with rural communities. And some of these rural communities have actually been able to win, 300-foot setback from oil and gas. And it's those same communities and community members who are working around dairy digesters and around factory farms, around all of those issues that affect rural communities.
And I would add to that the National Rural Health Association, which advocates very vigorously for better health access in rural areas. As many of you probably know, health access in rural areas has deteriorated greatly. Many hospitals have closed. There is an absence of physicians and nurse practitioners in many areas of the country. And so for that access movement, bringing concerns about climate change to join that movement, and having that movement specifically make the case that climate change makes it that much more important that there is better access in rural areas, and incorporate and join those concerns together.
Great, thank you. And I'm going to now turn it back. Please continue to include your resources in the chat function, but I'm going to go to the next slide. And I just want to take a moment and thank Mark Oswald, who's EcoAmerica's Network Program Manager, who has been behind the scenes advancing slides and making sure that everything is running smoothly. So especially these days, I just think a huge shout out to everybody running tech behind the scenes. So thanks, Mark. And I'm going to turn it over to Laura Kate to walk us through our call to action. We know it is a good strategy to end with your ask. Whenever you're talking to an audience of any size, of any background, it's an important tactic to make sure that you end with your ask, and we will do the same of you right now.
Great, thank you so much, and thank you everybody. A few things I'll walk through for immediate action steps. So number one, as Mona mentioned, if you go to climatehealthaction.org, first of all, if you know of health and medical organizations that should be on the call to action on climate, health, and equity but are not, whether that's an organization that you're a member of or one that you work with, please do encourage them to sign on as an organization. We're so proud of the wide breadth of health and medical organizations that are on, but we can always use more. And as has been mentioned, it is now open for individual sign on as well. We're really excited about this. It's an opportunity for you and other individual health and medical professionals that you know to endorse the call to action yourself and help build a cadre of like-minded folks who we can use to point out the widespread support from both organizations and individuals of the call to action. So climatehealthaction.org, if you do nothing else today, please go and add your name as an individual in support. Thank you. Second, I wanted to share a resource around elections. So obviously it is election season. It is, well, pre-COVID-19, it was top of mind for a lot of us, and it will continue to be top of mind, I think, throughout the year. For those of you who, like me, work for 501c3 organizations, you may know that we are very restricted in what we can do around elections. So specifically, charities like the American Lung Association and I think all the groups represented on the phone, we don't pick candidates, we don't endorse or oppose any particular candidates, we're not affiliated with any party, and it's really important that we continue to abide by those critical guidelines. But that said, there are opportunities for 501c3s to engage if they're interested and to do so in a legal way. The resource that I've included here is from a group called the Alliance for Justice. A couple of us have worked with them before. They provide assistance for nonprofits who are looking to do work in elections and stay on the right side of the law in order to advance their issue as opposed to advancing a particular candidate. What I've linked there is a great fact sheet that they put out through, that's the Alliance for Justice's Boulder Advocacy Initiative. So please take a look. They're also available for, I think, relatively low cost to consult with individual organizations who are looking for help. I'll add that many of the organizations on this call are also currently exploring ways that they can engage to advance the issues of climate change and health in the 2020 elections with, again, as 501c3s, so stay tuned for more information on that. And of course, I'll also remind folks that you are free to do whatever you can in your own individual capacity to further climate change and health in the 2020 elections. I'll just say, so on this slide is, again, the American Lung Association's petition to EPA to defend the use of sound science in their policymaking. That's lung.org/savescience. But all of us on the call who have put, whose organizations have put this together today have our own opportunities to take action, some on this issue, some on others. I know that everyone gets a lot of email, but all of us would appreciate it if you visit our website, sign up for our action alerts, because I know I can speak for everyone when I say that we're judicious when we send out emails on advocacy, but we make sure that it's really important and that it's really impactful. I know it doesn't often feel like clicking through to sign on to a letter or to send a quick message to an elected official. It only takes a minute of your time, but the offices really do take it into account when they're making considerations. For example, EPA has to log and respond to the public comments they get in their final regulations, and Congress actually does take it into account when you contact them. So this is my pitch, not just for the American Lung Association's opportunities, but for all of the organizations on the phone, that we always appreciate you connecting with us so that we can keep you informed on key action opportunities. Back to you, Rebecca.
Thanks so much. We are just about at the end of our time together. I want to extend a huge thanks to everybody, who was here in the beginning, who stayed on the line, and who all of our speakers, not only for the work that you presented today, but the work that you're doing every day. I just can't thank you enough. It's a wonderful opportunity to host today, to partner with you all on a regular basis, and looking forward to engaging all of the folks who are on the line today to further climate and health action. I want to end with quite a poignant question we got in the Q&A section, and perhaps one of our panelists will jump in and answer, and perhaps it's just something we take home and think about. But people in governments across the world have, for the most part, come to recognize and address the acute public health threat of COVID-19. What's the single most important step we can take to awaken people and governments to what is still seen as the quiet, chronic threat of our climate crisis?
Well, I would say we need to speak up about it. We need to use our voices. We need to use our trusted voices as health professionals, and let not only our policymakers and our communities, but our family and friends know how important we feel this is, because there's not nearly enough discussion of this out in the world. So just talking about it can make a difference. Being vocal. Sure. Speak to people.
This is Linda. I'll ditto that, but I also think that we need to impress on our colleagues, our friends, and our policymakers that everyone has to respond to climate change, just like everyone is responding to COVID. And we also really need to vote like our lives depend on it, and support all of the community-based organizations across the country that are acting like their lives depend on this, and support their efforts, and use our health voice to demand that government tell the truth about the climate crisis and act accordingly.
Wonderful.
I would add, I think we are now all on the front lines in a different way, or are aware of how, if we breathe, if we drink water, if we exist here, we're all on those front lines, whether it's COVID or climate. And so I think understanding how to be part of the broad social movement that is going to change this is what we need to do. And that means getting involved, supporting, like Linda said, supporting our organizations today and beyond, and asking for what we need in terms of real bold and courageous action. The voice of health professionals is critical to that. And I'm going to end with the story if I can. I was asking a doctor, very well-known, had been a public health officer, to sign a letter in support of the 2,500-foot setback, and he felt he couldn't do it. And at the end of the call, he said, but I know you're on the right side of history. Well, we need you more. That we need that voice to be bold, even if all the science isn't there. We need that precautionary approach, and you are the messengers for that public health voice and message.
Hi, this is Lalita Serpanini. So I think from my perspective, making sure we highlight the human stories of climate change. This crisis has really helped a lot of people understand issues of equity and interconnectedness. I think continuing to talk about how prevention is very important and making sure we highlight people's stories.
Nothing has shown more clearly than the last few weeks how ignoring reality, ignoring a threat can lead to disastrous consequences. So we must respond. Everybody must respond.
Great.
All our organizations and all the individuals we know.
Thank you again, everybody, for joining. Thank you to our speakers. We will be posting the webinar recording in the next couple of days. Please make sure to engage with us online for the rest of National Public Health Week with the hashtag NPHW. And we look forward to working with you on advocacy actions in the coming year and beyond.
Thanks.
Thank you, Rebecca.
Thank you.